Let's revise a little bit together. The exams are coming pretty soon. The first exam is supposed to be on the 25th of March, second one on the 24th of June, and the third one of the year on the 28th of October. But these dates are subject to change. Hi guys, welcome back to my YouTube channel. Today we're going to talk about the thyroid disease, and we're not going to go too much in depth, but this is just like a revision guide, you know, just to help you as you are studying. I'm just going to highlight a few things that I think are important for you to not miss out when you're studying and to go to the exam knowing. So, first of all, I'm just going to say, like the thyroid disease, right? Whether it's hyperthyroidism, where we've got overproduction of thyroid hormones, or hypothyroidism, where we have like low production of the thyroid hormones. The thyroid disease is most common in women, right? And when you go down to things like Graves' disease, you find it 9 times more in women between the ages of 40 to 60. So that's just one thing to just know, first of all, that thyroid diseases, because they are autoimmune in nature, and generally autoimmune diseases are more common in women. We are going to start with a quick overview of the on the functions of the thyroid hormones. We need to understand how they actually work so that we get to know the entities that are within hyperthyroidism as well as hypothyroidism. So in hyperthyroidism, we have increased basal metabolic rate, increased carbohydrate metabolism, and increased fat catabolism. And as a result, you realize that when we increase the thyroid hormone, meaning in hyperthyroidism, these things are even more increased, right? These functions. That means someone is bound to lose weight because you're saying the fat catabolism has been increased, carbohydrate metabolism has been increased, basal metabolic rate has been increased. And in hypothyroidism, these things are the opposite, they are reduced. So someone will be bound to gain weight because the metabolism is slow. And then we also have increased vitamin requirements, like to just sustain all these things. The metabolism that's also high, we also need a higher requirement of even energy. Then we also have increased cardiac activity, which means in hyperthyroidism, we're going to find ourselves experiencing tachycardia, palpitations, atrial fibrillation. So you can have a tachycardia, like they can give you a patient with a heart rate of 125, 130, things like that. You get a bradycardia, like a heart rate of 45. Hypotension, worsening congestive heart failure, angina, pericardial effusion, and mixed edema of the heart. So that's the other thing. Then you also have stimulation of the GIT. So here we're saying thyroid hormones stimulate the gastrointestinal tract. So in the presence of hyperthyroidism, we're going to be having diarrhea, which is our hyperdefecation in spite of and then we've got weight loss in spite of an increased appetite. And then when the thyroid hormones are low in hypothyroidism, we're going to have constipation because the gastrointestinal tract is not being stimulated as much. So you've got constipation, and then what I spoke about metabolism, you've got weight gain despite poor appetite because the metabolism is slow. And then to have the increased muscle activity or see fine tremors in hyperthyroidism. We also have like the muscle weakness, hypokalemia, and then we've got also an increased endocrine activity. We're going to quickly dive into our questions. What you can do is pause the video and read through the options A to K. So this says, for each patient described below, choose a single most likely diagnosis from the above list of options. Each option may be used once, more than once, or not at all. So you can pause the video, read through the options so that when you read the question, you can quickly identify which answer you want to go with. So the first question says, a 28-year-old woman has developed rapid weight loss
and palpitations. You notice lead lag and a goiter on examination. So in this question, we are clearly in the presence of hyperthyroidism. So with that in mind, we see that it's Graves' disease, because that's the entity of hyperthyroidism that is given. And Graves' disease is an autoimmune disorder which primarily affects the thyroid, leading to that same overproduction of thyroid hormones, hence it's hyperthyroidism. So you get your weight loss, and remember when you're describing it, you said weight loss in spite of increased appetite. Here they didn't talk about appetite, but you get your weight loss, you get all those things like rapid irregular heart rate, palpitations, tremors, muscle weakness, nervousness, goiter enlargement. Here you've got exophthalmia. So this is definitely our answer. That is A. And the second question says, a 17-year-old man has noticed a painless, smooth swelling just above the suprasternal notch. He has had the swelling for 2 years and is well. It moves with swallowing and tongue protrusion. So from our answers, right, I'm going to first start with one of the methods I use sometimes is elimination. So I'd say Graves is out because it's hyperthyroidism. This patient has no hyperthyroidism symptoms. Hashimoto's thyroiditis is like the leading cause of hypothyroidism. We don't have that. Myxedema as well, we have no signs and symptoms of that. Euthyroid goiter, I would say, okay, it would be among the differentials since there is a swelling there, right? And doesn't necessarily have to give me other symptoms. And then you've got Hodgkin's disease, which is automatically out because of the symptoms it brings, like, night sweats, fevers, depending on if they're talking of Hodgkin's lymphoma, if it is, the Hodgkin's or non-Hodgkin's and stuff. And then you've got the thyroglossal cyst, that is another differential. And then you've got carotid artery aneurysm. Okay, that's just out. And then TB abscess, no, there is no evidence of an infection in that question. And pancreatic carcinoma, nothing pointing to that either. Superior vena cava syndrome, you don't have the symptoms as well, like, facial swelling. And then you've got thyroid cancer. You also don't have symptoms enough to justify that. So I would say you've got between the euthyroid goiter and the thyroglossal cyst. So if you come down to this, right, it makes it better for your exam, like if you know most of the things. And then now, I would say, the answer is thyroglossal cyst, right? And that is because we know that a thyroglossal cyst, it's actually described as a painless lump. That's one of its major characteristics, right? And then it is also said, or that is like unless, of course, it is infected. But yeah, normally it's a painless lump, right? And then you get other symptoms like maybe difficulty swallowing or breathing if it grows too big and starts compressing nearby structures. But the other thing that they mentioned that just sold it out was the tongue. It moves with swallowing and tongue protrusion. That is also classical of a thyroglossal cyst. Between Hodgkin's disease and TB abscess. So for me, I would say, in TB, you've got more of chest symptoms. Here, they didn't even mention a single chest symptom because the general symptoms, like, night sweats, anorexia are kind of common in both entities. And then in TB abscess, the abscess itself is not as hard. So I think that's the other thing. Like Hodgkin lymphoma, the lymphadenopathy are multiple and hard. And this is what we have here. Like it developed multiple hard swellings. I guess the hard swelling on the left side of the neck. That's what would be our cue. Like because most of the things are basically identical. Though if they'd given us more information, the other differences would be for TB, it's mostly common in just the neck, but Hodgkin's also goes even to the axilla, and you can also get inguinal lymphadenopathy. Yeah. Then the Moches symptoms in TB and TB abscess also, I think it's common in the chest as well, and then you have that feculent sputum and stuff. Yep. And then moving on to our number 5, which says a 67-year-old male smoker has developed gross edema of the neck and face. You also notice swelling of both hands. So this one is what the only answer here that's correct is the superior vena cava syndrome. If you remember, like, the superior vena cava, right? It's that vein, that large vein that brings the blood that is drained from the head, neck, and upper limbs into the heart, right? And then the inferior vena cava brings everything from the bottom coming up, right? And then, yeah, they all meet in the right atrium and stuff. So before they even get to the heart, we are saying if there is an obstruction in the superior vena cava, which in this case, because this man is a smoker, maybe he's got cancer, and that smoking is probably going to cause cancer, and which has caused some metastasis, and that has obstructed the superior vena cava, or whatever the case, the cause of the obstruction of the superior vena cava. The fact is, when the superior vena cava is constricted, right, it's like you've got increased pressure in the veins, and that's going to cause fluid to leak into the tissues, giving you edema in your head, neck, and hands. And then the next question says, a 20-year-old medical student is concerned about recent weight gain and lethargy and constipation. You notice bradycardia, a goiter, ankle reflexes are sluggish, her periods have stopped. So here we know that with all these signs that we've been given, we are in the presence of hypothyroidism. So our answer here is going to be myxedema. Then the last question says a 72-year-old man with weight loss has developed a hard swelling in the left superior fossa. And our answer here is going to be thyroid cancer. Signs of hypothyroidism include A. Dementia, B. Hirsutism, C. Bradycardia, D. Hyperreflexia, and E. Carpal tunnel syndrome. So from these ones, A. Dementia is correct, B is wrong, bradycardia, we spoke about it, it's correct, D, that's for hyperthyroidism, E, carpal tunnel syndrome is correct, because what happens is when we have weight gain, for example, secondary to the hypothyroidism, then we've got compression of the nerve in the wrist, and that causes our carpal tunnel syndrome. Then ocular features of Graves' disease: A. Cataract, B. Iritis, C. Exophthalmos, D. Proliferative retinopathy, and E. Ophthalmoplegia. So cataract is correct, A. Exophthalmos is correct, C. And ophthalmoplegia is correct, E.